We have Mrs. DeAnna Ferguson with us today. And Mrs. Ferguson is the Vice President of Government and Community Affairs at Volunteers of America at VOA, and founder of Alabama Service Providers Association, ASPA. And today we're going to be speaking about legislative advocacy and some of the things that are going on right now with the local Alabama government. And at this point, I'd like to hand it back over. And Mrs. Ferguson, if you would introduce yourself.
Hey, good morning. I am DeAnna Ferguson, and I work for Volunteers of America as their Vice President of Government Affairs and Community Affairs. And another bonus opportunity I got a few years ago was really helping orchestrate a coalition of community providers. And we founded the Alabama Service Provider Association a few years ago. And so I'm very excited to tell you more about that and what we're doing and who we are.
Well, thank you for being with us today. And Mrs. Ferguson has shared a PowerPoint presentation that we're going to run through today. So if you guys have any questions, please go ahead and put them in chat. And what I will do at this point is go ahead and share my screen so you guys can see that PowerPoint. And Mrs. Ferguson, can you see the PowerPoint as well?
I can. Thanks, Alex.
Okay, so let's talk about who ASPA is.
So we are an inclusive association of providers of community-based services, and most of the providers that are part of our membership are providers of the Medicaid waiver home and community-based services. So we provide services for adults and children with intellectual disabilities throughout Alabama. And we are a 501c6 nonprofit, and we came together in order to share common problems and hopefully be able to develop solutions for those problems.
It's always nice to have a group of people that kind of amplify that voice when you're going and talking with the government, local agencies. And so what's the difference between 501c6 and 501c3?
Well, I am not a lawyer by any chance of the imagination, but my understanding is that the 501c6 it is typically an association of nonprofits where it's an association of an association. So the difference between 501c3 and c6, the main difference in my mind is you are allowed to lobby and to advocate for legislation and funding more so than you could with a 501c3. You're very limited as a nonprofit.
Gotcha. I didn't know that existed. So thank you for pointing that out. Now, the ASPA is an association of providers. How many providers are there in the state of Alabama?
I knew you were going to ask me that, and I should have taken count. Actually, if you'll go to the next slide,
yep.
I've got our current membership list listed out for you. So there's 20 something. In fact, we just got a new member this week, the Blunt St. Clair 310 Board, which is a group that provides support coordination for the Alabama waiver. So yeah, we have small providers as well as some of the largest providers in the state that have joined. We started with just a couple of providers, and over the last couple of years, we've really grown. And we're very excited about that. We do offer vendor membership too, and we have a couple of vendors as well. Genoa Healthcare Pharmacy Solutions and Therap Services are vendor members that are listed here.
And you talked about the size there. Do you have to be a provider in order to be, or a vendor in order to be a member of ASPA, or can anybody be a member?
Anyone can be a member, and we have not really started marketing that out to everyone, but on the last slide, you'll see our website is aspanow.com. But information is on there about membership, so you can be, I think it's referred to as an associate member, but it's just anyone who's interested in what we do and the issues that we advocate for. Part of what we do is really sharing information with each other, what's going on in the state from a legislative standpoint, what's happening with a programmatic standpoint, as well as nationally. ASPA is also a member of ANCOR, which is the American Network for Community Options and Resources. And so we have some national advocates as well there. And it's a trade association of all DD providers. We are part of the State Association Executive Group. So again, most states do have an IDDD provider association. And so, which ours is, we're all volunteers as far as the board. We have a small board, which we are hoping to expand this year. But you know, we're volunteers. We're all providers, and so there are associations as they grow that actually hire staff, full-time staff, to be the executives of these associations. And so I participate on weekly calls to see what's happening in other states. With, you know, whatever issue is at hand. And of course, as you can imagine, COVID-19 and as well as federal and state relief funds for providers who are truly struggling to stay afloat and to continue to provide these essential services to people with intellectual disabilities, you know, in our communities.
And I will say, as you saw on the list there of the members of ASPA, we are a member. My organization, Bridget's Home Inc., is a member. And especially during this time, I mean, I would just want to say thank you to you and your organization, because I get a lot of information about, you know, the COVID relief stuff. And these documents are really long and confusing. And you'll go through and highlight the important stuff. It really helps break it down for me. And make sense of it there. So if any of the providers are thinking about becoming, you know, a member, or anybody that's in the community that wants to know more about how to amplify their voice and kind of what's going on behind the scenes, I would recommend becoming a member of ASPA there. Let's get a little bit more into what we do, and I will go ahead and share my screen once again here. Just one second. Okay.
So our true mission is to improve services. I mean, that at the end of the day, that's it. And for many years, I've been working in this field for, you know, almost 30 years. And we've, you know, there's different groups. There's some, you know, some smaller kind of mom and pop organizations which provide wonderful services. And there's some really large providers and national providers such as, you know, the ARCs and UCPs. And in other groups. And like I said, I work for VOA. And so just for many years, we would go to meetings and find out information, and everybody, you know, it was just, there wasn't that collaboration. There wasn't sharing. And in some, you know, and granted, sometimes we don't always agree on issues. I think one of
that's okay.
And that's okay. But again, that will not be something that will be on our priority list or our platform. It's all, we have to agree on the issues that we are taking forward collectively. So but many voices are much, much stronger than one voice. Mm-hmm. And so we really have to pick and choose our battles here. And again, making sure that quality care and services are accessible and available to people here in Alabama with intellectual disabilities and their families.
And I was going to ask, but I'm going to wait, or what are some of those battles? But before I do, let's talk a little bit about the history. And I'll go ahead and pull that slide up as well.
Sure. So yeah, like I said, Alabama actually was one of the few states that did not have an IDDD provider association. And I remember I would go to national meetings with ANCOR, because I was an ANCOR member prior to ASPA being formed. And other states were shocked. Like, how do you get anything done? You know, how are you able to advocate for rate increases or, you know, some regulatory relief? And it's like, well, we really have not been successful. And she said, that's the problem. So Diane McComb, actually, who I have to give a shout out to her, she's kind of a mentor to me. And she worked at ANCOR, and she said, build it and they will come. And so anyway, that's how we started in 2017. my CEO was very supportive and encouraged me to do this. And so we decided to take the lead in establishing a statewide association. I just incorporated the 501c6 and started reaching out to some of my colleagues, Susan Klingel with the ARC of Madison County, Chris Stewart, ARC of Central Alabama, Rob Rogers, that is our Senior Executive Vice President at Volunteers of America, and Karen Stokes, who's Executive Director of ARC of Shelby County. Because they saw the need, and even though many of them are part of ARC and they have their ACE ARC group, it needed to be a collaboration of all the providers. And again, my dream is that I believe there's 170 providers in the state. My dream is that all of them would be a member of ASPA at some point. So that, that's where we need to go so that we can all be on the same page and truly advocate for changes that we need in the state. We've been successful with some things, and we've got big plans ahead of us. So we need all the help we can get.
Now, what does a member look like? Now, you said you're on calls weekly, but does that mean a member is expected to tune in weekly, or what would I expect signing up to be a member?
So if you were a member, we do push out through email monthly newsletters, and we're working on revamping those. But it's just a collection of all the information that's coming in to me so that you'll get it. I try not to overflow people's inboxes. So unless it's something that is new and you need to know now, or if it's an ASPA alert where I need you to call a legislator or to call someone at the department or to sign off on a letter, I won't push emails out every day to you. But really it's just more you getting information. We try to have a quarterly membership meeting. And right now, of course, there's Zoom. Initially, they were in person, and our plan was to move them around the state. But Zoom meetings are so much more accessible to people, and especially now where it's a requirement. But just being able to, if you can, tune in and just to participate. We want your input. We want your feedback, because we want to make sure what we're doing is something that's beneficial to everyone. And there are things that are different. Some smaller organizations may be struggling with issues that maybe a larger one's not, and vice versa. So just being able to share with us your needs and help us come up with solutions so that we can move forward. And another piece of this is, the membership dues, because there are dues involved, and it's based upon revenue of your organization. Smaller organizations obviously pay a smaller amount. And one of the things that is new this year is if you need to spread those payments out quarterly or monthly, you can. Mm-hmm. So because we want to make sure the membership dues does not prove to be a barrier for people to join, because beyond that, we really need the numbers. We need to be able to say, we represent 100 providers. We're serving 5,000 people among these providers. So, but the membership dues are important in that it helps us to contract with a lobbying firm. Mm-hmm. And that has really made a difference. I'm an advocate. I've always, I've been an advocate, honestly, since I was probably 8 or 9 for people with disabilities. But the thing is, having that expertise and having those connections in Montgomery at the State House has been instrumental in getting us in there so that we can have lunch with certain legislators on committees that are deciding where these funds are going and how they're going to be spent. Mm-hmm. So that's where pretty much 100% of our dues are going toward the lobbying contract.
So let's talk a little bit about success stories before we get into what you're going through now. So thinking back on the past few years, what's something that you'd really like to highlight?
Well, one of the major things I know, and it's not all about money, but at the same time, quality care has to be provided by quality staff.
Mm-hmm.
and providers can't pay staff unless they have adequate rates. So one of the biggest successes, I think, and it sounds minuscule when you think about the 2.5%, but we were able to, year before last, get a 2.5% increase in residential rates, which made a huge difference for so many providers in the state. It seems small, but again, in Alabama, you have to think, we get for the waiver services, I think it's 74% or 75%, it changes every year, is federal match. So for every dollar that our state budget funds, we get, essentially $3 from the federal government to provide a service. I mean, that's a good deal. So
I think it's a great investment.
That's like having a 75% coupon at Kohl's. I mean, that's awesome. So it's a great investment, absolutely. And so we just have to make sure that our state legislators understand that and realize what an impact those funds can have.
Yeah, it's investing in the local economy. If the legislators spent, like you said, spend $1, they get $3 back, and that money stays in Alabama, which I think is really big. It doesn't go to big corporations that are out of state. These are smaller providers. These are in-state places. So I think that's really cool, and that's the FMAP, if I'm correct.
Right, that's the FMAP. And then another, I think, success, even at the beginning of this pandemic, was we were, a lot of providers were struggling because we're required to have with our employees a TB skin test prior to their employment. Well, the clinics weren't open, and I mean, it was really causing a barrier to us hiring staff. And as you know, there's such a high turnover of direct care staff, and making sure that you could bring them in. And, I mean, people were struggling to do that, and so we were able to really push with our Alabama Medicaid agency to get them to waive that and just do where our nurses could just assess the person for symptoms prior to hire. And, which it sounds so silly, especially when we're looking at COVID-19 and here we are worried about tuberculosis. And so, so we were able to do that. But again, that it sounds minor, but it's major when you're short staffed and you don't have enough staff to work, and you have to have that support for people.
Yeah, kind of lowering the barrier there to allow people to come in and work. You mentioned there was a 2.5% increase. When was the last time that rates were increased? I feel like it hasn't been 7-8 years before there was an increase.
Right, there really hasn't. If you go back and look, honestly, in 2005 is when Alabama changed their reimbursement method to a fee for service. And truly, there's been very few increases. I mean, maybe 1 or 2%. However, there were a couple of increases we got, they took back within the fiscal year. And then we've had 3 minimum wage increases since 2005, much less, the Alabama, the Affordable Care Act, and the cost, as you know, the surge in what health insurance cost. So, just cost of living, you have to be able to keep up with cost of living because our staff, our employees, are dealing with it. So each year they're making less money, actually, if they're not getting routine raises.
Yeah, their dollar's worth less. You can buy less things at the Dollar General.
Exactly.
15 years later. So, okay, let's jump into things that are going on now, and I will go ahead and share my screen again. So what are some of the priorities that you're going through now?
So right now, these are in no particular order. All 4 of these are extremely important, and we'll go through the next slides, kind of break them out. But, CARES Act funding, COVID-19 vaccine priority, the next year's, the fiscal year 22 budget request, and then an ANEM registry. So those are the 4 main things. And if you want to go to the next slide, Alex, we can just kind of talk about them one by one. And this has been in all the papers, Alabama.com feeds. So I'm sure everybody's heard of this. And but Alabama received 1.9. I say it's 1.9. Technically, it's 1.75, but $1 billion in the first CARES Act. And that was that federal CARES Act, which it was allocated to different states based upon census. So we really got 1.75. And so it was supposed to be sent for COVID relief. Mm-hmm. And again, if you remember, there was some, there was a question about how to push that out, if it should be the governor's office, legislators. So they finally worked that out. But the big thing is it has to be spent by December 30th, or it goes back to the federal government. They are pushing for an extension, all states are, but so far, nothing, which it has been kind of, a lot going on in DC lately.
Yeah.
But $858 million of its 1.7 billion allocation has not been spent as of last night. And I put a link in there, Alex, and you might be able to copy and paste that in the chat room. It's kind of a cool dashboard, or we can send it out later or whatever on your page. But it's really cool because it's a interactive. It's CARES Act dashboard, so you can see what each department, each division in the entire state, what they got allocated out of the 1.7 billion dollars, how much they've spent, and how much is left.
So where exactly are we? Can you see my screen right now where I've shared that link?
Let's see. Can I? Yeah, I can see. You know what? I had inserted it in that CARES Act dashboard. So it's not popping up. But
it's not popping up there.
Yeah. So, so I don't know. You might could grab it out of the email that I emailed you and copy and paste that. But it's really cool. So
what about?
Yeah, there you go. There, that's it.
Okay.
So, but for each of the different divisions, you can see what it, and it's like, it's real time. So if somebody is spending it right now, it'll show up, or it'll add it to what's been spent and take away from what's been unspent. So
about half of it's been unspent. Do you see this in other states as well?
Yeah, a few states. Some have done better than others. Again, and I can imagine, not trying to throw stones. I'm sure there was a lot of logistics to work out on this.
I was just going to ask, why do you think it hasn't been spent?
I'm not sure. I think just trying to make it equitable, and I think a piece of it was maybe, I don't want to use the word hoarding, but saving for a rainy day, thinking that something would come up, they really needed it later. So yeah, and this is, it's something that right now we're pushing for, because the mental health provider program, the governor did put $7 million toward mental health providers, community providers, and so far only 1.3 million has been spent. So we've got 5.6 million out there that we really need to be pushed out. And I do realize that within the parameters of what is eligible expenses and not, there's a lot of ambiguity, I guess, on what is COVID relief and what is not. It can't be to replace revenue. Mm-hmm. That's one of the things, but at the same time, it should be to help purchase things that are needed for COVID relief, as well as perhaps make changes within programs and within business models to move forward in this new post-COVID world that we'll be entering as we enter it, because things will never look the same. I really don't believe things will ever look the same as they did prior to March, as far as our system, our IDDD service provider system.
Yeah, and some of those expenses like Zoom, everybody's got Zoom now. You had to purchase an account to do that, to speak with your staff, to speak with your managers. Masks, I never bought masks before this. Those are things directly related to COVID. So if we can use that money for those reimbursements, I think we should, if they're going to allow it. Like you said, I don't want to say free money, but we got to give it back to the federal government if we don't spend it. And if your spending has gone up because of COVID, you should take advantage of that, and they're allowing it.
Right, exactly. And so try to make sure that providers know that money is there, and making sure that the Department of Mental Health works with us, because some people, you don't have the cash flow, especially we have such a reduced revenue because some services have stopped or drastically reduced. So being able to reassure providers, buy PPE supplies or buy Zoom or tablets or whatever you need, and you'll get reimbursed. I think that's one reason providers have not taken advantage of it, is because they're scared to put the money out there, make the purchases, and not have 100% surety that
guarantee that you're going to get reimbursement.
They're going to get the money back. And so
Yeah.
that's one thing that that we're hoping that the department will definitely will do, and so that we can spend that money. The money was allocated to us for this purpose, and so we need to take advantage of it and definitely not send it back.
So how do we make sure that we do take advantage of it in the next month?
So we are working with a couple of things. So we're working with the Department of Mental Health, looking to see what can be done. We worked with Alabama Disability Advocacy Program too, and the governor's office, to see how can we access these funds. In Virginia, they were able to come together and access CARES Act funds for a bonus for their direct support staff. I would love to do that.
That would be awesome.
Virginia was able to provide I think they had over 40,000 people as far as direct workers, be able to get a $1,500 bonus. That would, be incredible. And so we are working with ADAP, who's working with the governor's office, having these conversations to see what can we do between now and the end of the year to do that. And as well as trying to figure out with our department how we can encourage providers to go ahead and invest in these PPE supplies, because that's not going away. I mean, and so far it's just been, reimbursement. You submit the receipts and you get reimbursed. So it's like, if we need to go ahead and purchase larger amounts, not trying to hoard, but go ahead and prepare for the next 6 months at least, that's what we need to do if money's there.
Mm-hmm. Excuse me. So you're working at getting those things, and the bonuses for the direct care staff. They deserve it. They deserve every penny of that. They are right there with the clients, the individuals, and they're angels. There are some people that are very good at doing those things. I am not one of them. I don't have the patience for it, and I greatly respect the people that do, and they deserve every bit of that raise and every bit of that bonus.
We all know that our direct support staff, our direct support professionals, they're not in this field to get rich, right? But we've got to do better. If we've got to continue to advocate in order to get funds so that they can be paid competitively. And during this crisis, they truly are the unsung heroes. I mean, they had kids that were having to do virtual school at home, and they had, a lot of our workers have, family members that they take care of, older family members, yet they were still coming to work, and very oftentimes having to quarantine with people we served that had been exposed or had tested positive, at the risks to their own health and to their own family's health. So it's just anything we can do to make their lives better, to show them how much they're appreciated, but also truly to help them make ends meet. So
let's talk a little bit about putting their health in risk by continuing to work. And here on the slide, let's talk about the vaccine priority.
So this is right now. In fact, just yesterday we met. We've got several of our ASPA members that are part of a work group for the Department of Mental Health, and we were able to talk with someone from the Department of Public Health about the vaccination plan. And this kind of summarizes it. It is on the Alabama Department of Public Health website if you want to see the entire plan. It is a little ambiguous because some people may not really consider our direct care staff healthcare workers. But at the end of the day, they really are. I mean, they're the ones who are keeping COVID from spreading among this population within, these programs, encouraging them to use masks, social distancing, et cetera, as well as providing, assistance with medication, and, our nursing staff, our direct support staff, are healthcare workers. And even though they're not classified as that, so we've pushed, and in fact, just today, ASPA, along with the Alabama Behavioral Health Association group, who represents community mental health centers, we're submitting to Dr. Harris a formal request, a letter, that this be expanded, or at least have some interpreted guidelines from him, so that our staff, once a vaccine is available, which we're looking at probably December, so next month, a few weeks away, really, but it'll be limited dosage. I think they have allocated 121,000 doses in December to Alabama. So if that is indeed the case, yes, I totally understand first responders and your frontline hospital workers, but we do want our support staff, as well as the people that we serve that are living in congregate settings and attending congregate programs, be eligible to be in that first phase, so that they can get the vaccine if they choose to do that.
You think it'll go through? You think Dr. Harris will give guidance on saying that direct care staff are healthcare workers?
I hope so. And I will say, even at the very beginning of the pandemic, essential workers were, waived so that they could go to work. And so the fact that he supported us, our staff being essential workers, to me, that goes right along in line with healthcare workers. So I am optimistic.
I think we should have done these broadcasts in the opposite time frame, because I could have put them on the spot when we did the broadcast with them. What was it, 2 weeks ago? I want you to tell the community, Dr. Harris, what are you going to do about this? So that's one thing that you're working with there, is making sure that the community is recognized as, it needs to be in phase one. The individuals that live in these community settings, and you hear stories about this, even in community settings like in New York, and nursing homes, long-term care homes, stuff like that. These have kind of been a breeding ground for COVID, just because everyone's in there in a closed space altogether. And a lot of people that are served by providers live in a house, maybe with one or two other people. And so it's a lot harder for them to distance there. And, we want to make sure that it doesn't get an outbreak of COVID in those homes. So I would think that they would be in phase one or shortly after, if not.
I do too. So we'll see, but we are advocating for that.
Let's go ahead and go to the next slide here.
And so, as we were talking about our direct care staff, in Alabama, starting hourly wage of your, typical DSP is $8 an hour. Again, I saw a sign for McDonald's this morning. They're hiring at $12 an hour. I mean, these are the people serving the most vulnerable group in our state. Our turnover rate in Alabama is 48% on average. So you're constantly hiring people, training people. And then DSPs, as of last year, that had been employed for less than a year, was 32.5%. So, you really want continuity with staff. You want someone who knows the person that they're serving, gets to build a rapport and relationship. Again, these are people helping individuals with disabilities with some of the most intimate, personal care. And so, you don't want a different person every week coming in to assist you with a bath. You want the same person. And so we really have got to do better. And that is ultimately our goal. And it's not just Alabama, it's across the country, this DSP shortage. But Alabama is definitely one of the the states where we're dragging behind.
Mhm. Yeah, I know my family member, she likes her consistency. She knows that on Thursday at 5 o'clock, this person's coming in. Monday, 8 o'clock in the morning, this person's coming in. If it's someone different, it kind of throws her off schedule a little bit.
Sure.
And I really like the way you put that. Some of the most intimate things, her team are helping her with. She wants to make sure, lifting her and getting her into the tub. If she doesn't trust that, you have control over her, or maybe that she's going to slip and fall, she doesn't need to go through that. And that comes with time and consistency of making sure that, they're properly trained, but they've been with her for a while. And you're saying that, a lot of that turnover happens because we're not able to pay these individuals as they should be, and they're going to other places like McDonald's to earn more.
Right.
And
exactly. And you can't blame them. You can't blame them. They have families to take care of. I've had staff that, quit. They didn't want to. They loved their job. But, in order to make ends meet, they had to make decisions and go work retail or fast food or wherever. So it's unfortunate. And we've got to put value where it should be. I would not want someone who is working, having to work 2 or 3 jobs. That's the other thing. They're tired. They are working 2 and 3 other jobs in order to make ends meet. And that's not quality care for the employee nor for the people that they're serving.
So you're talking to Congress and the legislators then about increasing the pay rate. And I'm going to go to the next slide here. And you could walk us through that.
Sure. So we are very excited and happy that our Department of Mental Health, our Associate Commissioner, Terry Pezant, has done a great job of listening to us. I do think she understands the providers' plight and where we are. She was a provider too before she went to serve the Commissioner of Mental Health. And so this year, and I say this year, this will be on this legislative session starting in February, but there is in the Commissioner's request to the Governor funds to increase reimbursement rates of direct care waiver services and in our nurse delegation program, which if you're not familiar with that, that's the proxy program so that a nurse can train and oversee a direct care staff assisting people with medication. So we're asking for, it's $7.5 million state dollars. Again, that's going to buy down another, 75% essentially of funds for that. We're asking for an increase of 8.7% for waiver services, with exception of residential involving direct care staff, so that we can bring up wages by $1 an hour. And then 6% for residential services with them to bring up the direct care staff wage to $1 an hour. And then the nurse delegation program, increasing it from $4 a day to $8 a day.
What is
that is all in the budget request. So the process is the different departments submit their request to the governor, and then the governor puts together her budget request and recommendations, and then the legislature reviews that and develops the actual budget that will go in there. So there's a lot of hoops we're jumping through, but we are very supportive of the commissioner's budget, and hopefully it will make it into the governor's budget. So that's where our first stop is on advocating to keep all of that in her budget.
Now, is it if one department gets an increase, does that mean another department has a decrease?
Not really. Luckily, Alabama right now is still doing well with their general fund as well as their education trust fund, because in Alabama we actually have two buckets of money. Even though there has been a decline in sales tax and hotel taxes and restaurants and all of that, internet sales, the usage sales of that which goes into the general fund, has increased. So right now we're not, showing any deficits, according to legislators we've spoken with recently. So each department makes requests. Some may make a bigger request than others, and again, it's additional dollars. Sometimes they request, one-time dollars for startup initiatives. So it's all different. But yeah, it is quite a task, I can imagine, that the legislators deal with on trying to get the money where it needs to go. And there's a lot of things that impact that, just like, with our with prisons right now, trying to put the monies there. I mean, we've got lawsuits that the state's having to deal with, trying to make sure that they comply and build enough space for prisoners, and it's constantly something. So again, I don't think our ask is too much. Is it everything we need? Absolutely not. I mean, I would love to triple that, because we have got to get to the point of where we can pay our direct care staff at least $12, if not $15 an hour. That's where we got to go. I know we can't do it all in 1 year, but at least this is in the right direction.
Mm-hmm. And it's really getting the ear of the people that make the decision for that. So, the lobbying, and I would say, how can somebody watching support these advocacy efforts? If they, how would you recommend they go about doing that?
Well, just, building relationships with your local legislators is huge. And that's who they listen to. And you need to let them know, especially if you have a family member with a disability, or you're a provider, or you are a person with a disability. You need to know who your legislators are. You need to visit them. You need to call them. You need to write them, because at some point, whenever these tough decisions have to be made, that's when we really need to reach out. And we always have alerts on our webpage, and we usually have a link where you can just click on it in order to find out who your legislators are, or it'll be a template form that you can complete, where it'll have the wording of what our ask is, whether it's voting on for a budget, or voting for funding relief, like with the CARES Act. So just be aware of that.
I hate writing. It's one of the most daunting things for me. So having a template there for an email would be very helpful. And I'm going to share ASPA's website so people can see exactly what that looks like. Alabama Service Providers Association, aspanow.com. And here you can kind of navigate around the website. They have a member portal for members. I would say the monthly bulletin there's a ton of information on that. But you said that you can go to the website here and find the email template.
I believe so. On the take action, I don't know if there's an action. I'm not sure. And again, gosh, I hope this is updated. And that's about becoming an ASPA member. But if there is an alert, it's usually posted there. Right now, we don't have an alert up, but it'll be posted, and you can click on it, and it will pull up the information for you to fill out the form. And according to your address, it'll bring up your district, whoever is in your House of Representatives or your state senator.
Very cool. I'd like to talk about the last slide here. I'll go ahead and pull that up. There's second to last slide. This is another thing that you guys are spearheading. The development of a registry to track abuse, neglect, exploitation, mistreatment. Tell us about that.
So, and this is something that we've been talking about, and I will say our Alabama Department of Health has been discussing it as well. Our associate commissioner is very aware of this and very concerned, and is working on getting something put together. But in Alabama, we do not have a registry that tracks staff, community provider staff that have been fired for abuse, neglect, exploitation, or mistreatment. Unless you've been convicted of a crime, it's not going to show up on a criminal background report. This right here shows, the departmental health standards, our administrative code was updated a little over a year ago, and prior to that, it just said you could not be convicted of a felony. So they have expanded it to say you cannot hire staff who, have been, have any of these convictions, reckless endangerment in the last 5 years, stalking, criminal trespassing. So all of this now is in place, which helps. Again, individuals that we're serving, a lot of people aren't able to communicate.
They're very vulnerable.
And they're very vulnerable, and can be easily intimidated. Just like our seniors, and so people do take advantage. And unfortunately, we just don't have a system right now that tracks if someone is physically abusive or even verbally abusive, and we fire them, in which we always do report to the police, anything like that. But as you can imagine, if it was a verbal abuse, the police, they're not going to arrest the person, probably. And even if they did, and they did a report, more than likely the district attorney is not going to take that to a grand jury. So what they do is they go to another provider and they get hired. And we're so limited in what we can tell because of legal reasons. We can say if they're eligible to work or not back for us, but still sometimes people are desperate to hire people because of the shortage, and people still hire. And so this has happened on numerous occasions. It happens every day, I'm sure. So what we're wanting to do is to establish some kind of registry, just like the child abuse registry that DHR uses, something like that, but something that's user-friendly and more timely. And it really needs to be real time, because providers can't wait 2 or 3 weeks to get approval from an entity that this person has been cleared. So we need something. Other states have put these together, exclusion list, adverse reaction list, but our State Department, we do report through our instant reporting system. Everybody that, any allegations of abuse, neglect, exploitation, or mistreatment. And then we follow up with that to let the department know if the allegation was founded or not, and what our course of action was. So they have that information. So being able to use that information to put together a list, so that before we would hire, an organization would hire someone, they could go in and check to make sure that this person has not already been fired for some of these egregious acts. And of course, I think one of the struggles is really you have to have a due process in there, so that employees that were I don't know.
I was just going to ask, is there any
wrongly
misuse?
terminated? Yeah, or say a provider for whatever reason didn't like that person and fired them and said this. There has to be due process for an employee, because again, you're restricting them from getting a job in their chosen field to work in. And so there's a lot of logistics in there, and but we are working on it, where we ASPA members are part of the work group with the Department of Mental Health and with the Alabama Medicaid Agency. So hopefully we're going to get some traction on this year.
Oh, it makes sense. If I go out of town and my dog has to go somewhere, I have an app on my phone that shows me all the dog sitters in the area. They've been reviewed by others. I get notifications, what the others have mentioned. They're great in this, that kind of thing. And it's a star rating system. It makes sense that we would have it, for hiring. I want it for if I'm hiring someone to take care of my loved one. I want to know that, somebody said, well, she was verbally abusive to my family member. We're not going to go that route then.
Right. Yeah. And ideally, we would love to have this registry open to anyone who is hiring someone to take care of their loved one. I mean, if I was looking for someone to care for my mother, I would want to be able to run their name through this list and make sure that they had not been fired for abusing or mistreating someone, whether it was a person with disability or a senior or whomever. So it's an essential piece to ensuring that people are safe.
You guys have your hands full. This is like 4 or 5 things that are on your plate right now.
Well, this is true, but I mean, we can't wait on any of these. And trust me, we have more ideas and more things that's on the docket for down the road. But these are the top 4 right now that we're working on.
I am going to go ahead and share the last slide here, which has the information for ASPA. And while I do, I'd like to ask, is there anything that we haven't talked about that you think is the community should know?
I just think it's so important that we have a voice from all the different stakeholders with people with intellectual disabilities, from self-advocates themselves. We really need to encourage people to speak up and tell their story. We need family members to tell their story about their struggles, but also about their successes. And compiling that information is so important. Being available to talk to legislators as well as Department of Mental Health, because people should have the opportunity to access activities in the community, housing, work, recreation, and not be afraid to do that. And just again, helping us advocate for whatever issue is near and dear to them, we want to support. So I appreciate the opportunity for this broadcast today, so I can reach out to people who maybe have never heard of us, and encourage you to go to our website and feel free to contact me directly if you have any questions, or if I can ever provide you guys any kind of assistance with anything. The whole system can be very confusing. I just spoke with a family member last week who was really struggling trying to figure out how to get their son on the waiting list for services. It's confusing, and that is one of the other things we were talking about, is trying to get some kind of flow chart that makes sense, and that family members and people with disabilities can really look at. And just like you said, there's so much verbiage and literature
so many
out
acronyms.
there. Yeah, and much less acronyms. And just being able to cut through all that and say, okay, do this first and do this next. And sometimes you just need someone to walk you through it. But thank you, Alex, so much.
Well, we appreciate you spending the morning with us. And I will say, if you've got a few days off over the holiday season, now is a great time to reach out to your legislators. So over Thanksgiving or Christmas, if you're not sure what to say, go to the aspanow.com website, contact Mrs. Ferguson. She can help you draft that, and there can be some templates through there. So now, the legislative session coming up, now's the time to act. Well, at this point, I'm going to go ahead and end the broadcast. Ms. Ferguson, thank you again for being here with us today. For the community, Ms. Ferguson is going to be with us throughout this year, whether that looks like a monthly or quarterly. But I think it's very important that we're well informed of the things that are going on at the legislative and the congressional level in the state of Alabama, and how we can, increase those efforts. So once again, thank you for being here with us, Mrs. Ferguson. And
happy Thanksgiving.
Happy Thanksgiving. Okay, bye.
Bye-bye.